Normal state. The colon and rectum make up the large intestine, and it is the last 6 feet of the entire digestive tract. The colon takes up water and nutrients from food and passes it along to the rectum. The colon is divided into 4 parts: the ascending, transverse, descending, and sigmoid. The epithelium produces mucus at the end to aid in excretion. The rectum is the holding area for the stool, and when full, it signals the brain to have a bowel movement. There are 4 layers of the colon: mucosal, submucosal, muscularis, and serosal. On chromosome 2, you have genes MSH2 and MSH6, and on chromosome 3, you have gene MLH1. These genes produce proteins that help repair mistakes in DNA replication.
When these genes on chromosome 2 and 3 are damaged, they are unable to produce the proteins needed to repair DNA mutations. This results in DNA mutations not being fixed, therefore leading to colorectal cancer. Normally, cells replicate and respond to outside signals telling them to stop replication when enough tissue has been produced. In cancer cells, they essentially become deaf to outside signals and replicate uncontrollably, at a much faster rate. Colorectal cancer is the uncontrolled growth of cancer cells in the colon or rectum. Meet Tom. He is a 55-year-old male who came into his doctor's clinic because he has been experiencing some of the symptoms of colorectal cancer. Some signs and symptoms of colorectal cancer include changes in bowel habits, which can look like constipation, diarrhea, urgent needs to have a bowel movement, and bloody stools. Constipation occurs because the solidified stool is unable to pass through the colon. Bloody stools occur when the bowel tries to pass by the tumor, but is obstructed. This can cause the epithelial lining to rip and the tumor to bleed. Other symptoms of the disease contributing to abdominal discomfort include vomiting, weight loss, cramps, and fatigue. Vomiting occurs when there is a backup of food in the gastrointestinal tract, therefore the body reciprocates by expelling excess food out the top end. Weight loss occurs when cramps and pain cause the person to lose their appetite, therefore not eating and losing weight. Cramps can occur when there is a blockage in the colon, and fatigue can occur because the tumor can steal the body's iron and bleed, which results in the accidental excretion of iron, which can lead to anemia and fatigue.
Risk factors for colorectal cancer include a family history of colorectal cancer, a poor diet, and a family history with Crohn's disease. Since Crohn's disease is an inflammatory bowel disease, there is an increased risk for developing cancer because the large intestine is damaged already, and there have already been some DNA mutations. A poor diet, which can be affected by high levels of fat, can cause an increase of bile acids by the liver, which can then be made into possible carcinogens, which then attack the colon. His doctor recommended a digital rectal exam and a colonoscopy. Other screenings include sigmoidoscopy, X-rays, fetal blood test, ultrasound, MRI, CT, and PET scans. However, the most accurate test is the digital rectal exam. Based on the test, Tom was diagnosed with stage 2 colorectal cancer. The doctor surgically removed Tom's tumor. Other treatments can include radiation and chemotherapy.
There are 4 different stages of colorectal cancer. Stage 1 is when the tumor is limited to the invasion of the mucosal and submucosal layers of the colon. The survival rate here at this stage is 90 to 100%. Stage 2 is when the tumor spreads to, but not through, the muscularis layer. The survival rate is 80%. Stage 3 is when the tumor spreads to the serosal layer and regional lymph nodes. The survival rate is 30 to 50%. Stage 4 is when the tumor spreads to adjacent organs, therefore it is metastasizing. Colorectal cancer affects homeostasis because when a tumor develops, it may obstruct part of the rectum, inhibiting normal bowel movements. It also affects homeostasis because the cells are mutated and rapidly dividing, causing harm to other normal cells. The proteins involved in cancer are the ones synthesized by genes MSH2 and MSH6 on chromosome 2 and MLH1 on chromosome 3. If these proteins are not synthesized because the genes are mutated, then there will be other mutations in DNA replication. Normally, these proteins repair damaged and mutated DNA. It is important to remember that cancer occurs over time and many mutations, not just from one mutation. The epithelial tissue in the mucosal layer of the colon is damaged when there is tumor growth. When the epithelial lining is damaged, it is unable to carry out normal functions.